I'm Adrihim. The topic of our discussion today is syndrome of inappropriate secretion of antidiuretic hormone, also called SIADH. What are the causes of SIADH? Those include the effects of different drugs, primary brain injury, the infective causes, hypothyroidism, certain changes at the kidneys level, increased urinary osmolality, decreased serum osmolality, and malignancy. How does human body know when to retain food and fluid and when to get rid of them? It's not you can just think to yourself, "Oh, I have had too much water, better get rid of some." But the fact is different. Usually human body uses chemicals called hormones to send widespread messages. Kind of like how PA system at school tells everyone to ignore the smoke blowing out of the science wing. The ADH hormone is released by the pituitary gland. It is the hormone that controls water retention in the body, and it also constricts the blood vessel. And incidentally, the vasoconstrictor drug called vasopressin is just ADH. So anyways, the more ADH floating around in human body, the more fluid will be retained. The less ADH in human body, the more fluid will be excreted. Now we will talk about fluid and electrolytes balance across the nephrons. Nephrons in human kidneys are the structures that physically control how much water is excreted from human body. Nephrons are mostly a series of tubes attached end to end and that move the fluids and wastes toward the bladder. These tubes though also allow fluids and electrolytes to move through the tube wall and back into the blood. They play a very important role in maintaining overall hemostasis of the body. ADH acts at what level? ADH affects the last two-thirds of these tubes called the distal convoluted tubule and the collecting ducts. So how does ADH act on nephrons? The tubes of the nephron focus almost exclusively on reabsorbing water back into blood. And the walls of these tubes are unsurprisingly made up of cells, which is a common trait among living things. Role of aquaportin. So, these cells of the nephron have protein called aquaportin, and aquaportin allow water to move quickly in and out of the cells. The more ADH floating around in the blood, the more aquaportin are available to facilitate water movement through the cells. So when ADH is low, most of the water flows through the distal convoluted tubule and the collecting duct, giving us diluted urine when ADH is high. On the other hand, aquaportin grab much of the water passing through these tubes and throw them back into the blood. Now, when we drink a glass of the water and that water is absorbed into the blood, the plasma osmolality drops, which means that human body is diluting the blood with that water. And that means that there are more water for all those blood cells to bounce around in the part of the brain called hypothalamus, which sees this drop in the plasma osmolality and tells the pituitary gland to slow down the release of ADH. So low ADH leads to lots of diluted urine, which brings our plasma osmolality back to normal. Now suppose ADH continues to be released. So even though the plasma osmolality has dropped, we are going to continue retaining water, and as we drink more and more water, we might expect our plasma osmolality to continue dropping. However, this isn't really actually what happens. As more water is retained, it dilutes the other solutes floating around in our blood like sodium. The extra fluid also takes up more space in our blood vessels, and this taking up of more space issue triggers another mechanism in our body that causes hormone aldosterone to stop being released. So less aldosterone is released in such case. So the role of aldosterone is water retention. But less aldosterone floating around in the blood causes the body to start dumping sodium from the blood into the urine, and that causes water to follow sodium. So we end up with excess water being excreted in the urine. With the sodium, which normalizes the fluid volume in the blood, so now our body is removing sodium from the blood that already has a low concentration of sodium. And this means that the plasma sodium osmolality is dropping significantly. And this whole mechanism we just talked about is called syndrome of inappropriate secretion of antidiuretic hormone. There are four patterns of ADH release in people with SIADH. Type A is completely erratic and is independent of the plasma osmolality. ADH level tends to be very high, so the maximum amount of the fluid is retained, causing urinary osmolality to be very high as well. Type B is a constant release of moderate amount of ADH. Type C is the baseline plasma sodium concentration level, which is set lower than the normal, in which there is failure to suppress vasopressin at low osmolality. In type D, there is normal osmoregulated vasopressin release, and there is inability to excrete water load. What are the symptoms and signs of low sodium in the body? Those include symptoms similar to dehydration or any other condition where sodium is low. Symptoms like headache, nausea, and vomiting are common initially, along with the muscle cramps and tremors as the sodium concentration continue to get lower in the blood, though the neurons in your blood begin to swell, leading to cerebral edema. And the cerebral edema leads to confusion and hallucination. And if this condition is left untreated, it can lead to the common downward trend that we see in most of the illnesses like seizure, coma, and death. So, what causes SIADH? Pretty much anything that messes with the secretion of ADH. Conditions like strokes, hemorrhages, or trauma to the brain can mess up the brain's ability to release ADH. Similarly, some drugs that act on the brain, like mood stabilizers or anti-epileptics, can change the way ADH is released. Surgery in general often causes an increased secretion of ADH, though we are not really entirely sure why. Obviously, brain surgery specifically to the pituitary gland also might cause extra ADH to be released. ADH can also be produced ectopically by the tumors, which mean the tumors themselves produce ADH outside of the pituitary gland and release ADH into the bloodstream. Small cell carcinoma in the lung is the type of the cancer most likely to release ADH in this way. Infections in the lungs and the brains are also linked to the increased risk of ADH secretion if some of your family members have had SIADH before. That means that there are possibilities that you might get SIADH as well. The best treatment for SIADH is to figure out what the underlying cause is. The excessive ADH released is controlled by restricting the fluid. Fluid restriction can help maintain fluid balance in the body, but we need to find out the cause of excessive ADH and treat it. Otherwise, the problem will not be solved. Patient can also start a high salt and high protein diet to help release the excessive loss of the sodium drugs that inhibit ADH secretion. In cases of the severe hyponatremic symptoms, hypertonic IV fluids are also administered. So thank you so much. That was all about syndrome of inappropriate secretion of antidiuretic hormone. Subscribe on Obs and Gynae. Allah Hafiz.